Hello, how are you doing today?
Are you the pharmacist?
Yes, I'm the pharmacist, Brian. How may I help you today?
Good, good. You can help me by helping me get rid of these meds.
Oh, sure, of course.
Cheaper price here.
Oh, sure, of course. I can go ahead and find you a new plan for that. I'm gonna ask you a few questions. Can I have your area code, please?
Huh?
Can I have your area code, please?
91701.
Sure, of course. And do you currently get Medicare?
I have Medicare.
HMO, correct?
HMO.
All right, and you don't get any extra help from Medicaid. And I'm gonna go ahead and add your drugs as well, okay?
Okay. These are my drugs right here.
Yeah, I'm guessing, let's see, it looks like from here you have the
I can't see anything.
The Aetna HMO. I'm gonna go ahead and put that in for you.
Okay.
All right. And do you know how much you pay for your medications?
I don't know.
Okay.
A lot.
Go ahead and add them in right now. You got Advair. You got temazepam. And I just want to tell you ahead of time, unfortunately the Benadryl won't be covered by the Medicaid. You have to pay for that over the counter. I'm sorry about that. Let's see. You also have Xgeva. Alright, so these are the 4 medications you're taking. I'm going to go ahead and input your pharmacy now. Which pharmacy do you go to? Is it the CVS on Kenyon Way?
The one that's next to my house.
Oh, okay. Is that the one in Rancho Cucamonga? This one right here?
Yes.
Okay, perfect. I'm going to go ahead and add a different pharmacy just in case as well. Alright, I'm going to go ahead and look up plans for you now that might be cheaper for you. Let's see. And do you care about your health costs, or do you just care about your pharmaceutical drug cost?
Just a drug cost.
So it looks like you're currently paying around $2,900 for
That's a lot of money.
per year. Yeah, I'm going to go ahead and try lowering that down for you right now. It looks like you also pay $5,800 for your health and drug cost total. I'm going to go ahead and decrease your drug cost right here. Do you use retail or do you use mail order?
Retail.
Retail? Okay. So especially this plan over here, Central Health Medicare Plan HMO, we might bring you down to around $2,500. In terms of this plan, it's a 4 out of 5 star plan, which is pretty good. It has additional benefits. If you look here.
4 out of 5.
Yeah, 4 out of 5 stars.
That's good, right?
Yeah, it's a pretty good plan.
Like Yelp.
Like Yelp. In terms of other services, you have hearing as well. As, you have 0 copay on your hearing exams. You also have some preventive dental insurance. Also, you have some diagnostic dental and then vision help.
I can't see anything.
It's a $0 copay for routine eye exams and other exams.
So I need that one.
Yes, of course. And in terms of your drug costs per year, it looks like you're gonna pay. It looks like it's similar for CVS as well as Walgreens. It's $2,500 per year. You can also lower the price of your drugs by looking at this, and it looks like you can go apply to some pharmaceutical assistance programs for your Advair as well as your Xgeva.
Why are those ones? Are these too expensive?
Yeah, those are the more expensive medications. This is how much you'll be paying around if you're in coverage during your coverage gap as well as after catastrophic. If you apply now and you get Medicare in June, you'll hit the coverage gap in July, and then you hit catastrophic in around September. You have to get prior authorization for your temazepam as well as your Xgeva under this plan.
What does that mean?
It means you have to ask your doctor to give additional verification so that you can get the medication covered by your insurance. And then you also have a quantity limit on your temazepam and Advair per month. Do you have any other questions?
Can I go home now?
Sure, let's go ahead and enroll you, and then we'll go ahead and get you home. All right. All right. Oh, I see here that you have 2 medications that are on the Beers criteria, which are it's a list of for people.
Beers criteria. What does that mean?
It's a list of medications on that.
I have to drink beer with this?
No, are potentially inappropriate for people who are over the age of 65, especially the temazepam and the Benadryl right over here, because they cause a little bit of excessive drowsiness, which can lead to
I need to go to sleep because I keep dreaming about World War II.
Oh yeah, we talk to your doctor and get that changed.
Okay.
So I just want to ask you to bring it up to your doctor, as well as the Benadryl over here. You might want to switch it over to something like Claritin or loratadine, which doesn't have as much drowsiness, which will help you out with any fall risk you may be having.
So I can have my allergies still, or no?
Yeah, it's a different allergy medication. You can try it. There's other medications like Zyrtec as well that you can switch to.
Okay.
You want to give it a shot. And that's about it. Do you have any other questions today?
Will those be covered by the insurance?
Not the OTC, but the medication that the temazepam may be switched to might be covered by the insurance. I'll go ahead and look for that afterwards.
Okay.
All right. Any other questions for me today?
Can you take me home?
Sure, of course.
Okay, thank you.
All right.
I can see clear.